Hey there, Theories and Skills students. Dr. Brazier here. Let's take a look at session 12. We've got this session, 2 more sessions, and we are done for the semester. You're doing so well. This is a role play session, so that'll take up a lot of time. But I noted that there's no skill setter for this week, so that is interesting. So let's take a look. So the topic for this session is family systems and integration of micro skills with multiple approaches. So this says, in this session, we'll examine family systems theory, an important model for addressing couples and families in counseling. We have concluded our study of essential counseling skills for the course, though you will continue to utilize them in assignments going forward. Please note that you can also use family systems theory, which is actually not quite accurate. So just as there are multiple theories of counseling, you've been studying them in this course, there are actually multiple theories with regard to treating families. And so some of you may take courses where you explore a lot of those, strategic, structural, there's a whole bunch of them, experiential. And so just like there are all these theories for treating individuals, there's also multiple theoretical approaches for treating couples and families. However, I would say that marriage and family therapists who ascribe to this theoretical orientation, or even if you're going to be a licensed counselor and you ascribe to this theoretical orientation, can also treat individuals from a systemic perspective. Bowenian family systems will talk about differentiation, and you can work as an individual with Bowenian, like the transgenerational, intergenerational concepts, with an individual client. And there's also internal family systems, which is from Richard Schwartz. And that approach sort of says that what is true of a family system, a whole group of family members in the world, right, or in the counseling room, is also true internally for each of us. That each of us has parts of ourselves that is normal, not abnormal to have different parts of ourselves, that we notice it all the time. I've talked to you guys about polarities or ambivalence, on one hand this, but on the other hand this, and we'll experience stuckness based on these polarities or ambivalence. Richard Schwartz's work with internal family systems would say it's just different parts of self that are in conflict with one another, and that the goal where, like, if you're trying to help a person move toward health, the goal of internal family systems is not to banish any parts or get rid of any parts, but rather to help all the parts of ourselves work well together as a team. So it's very interesting, but you can work with individuals from a family systems perspective. Okay, let's take a look at reading and viewing for this week. So you're reading in your TAN book, Chapter 13, Marital and Family Therapy. In your Corey book, you're reading Chapter 14, Family Systems Therapy. You're watching not 2 videos by Dr. Fiddler this week, but just the one talking about family systems, where he tries to capture, just in a nutshell, what family systems theory and therapy is all about. You'll also take a look at a Case of Gwen video that's like 5.5 minutes long. You'll find that through MindTap. You're used to that. Then there's a survey for your final paper. You need to take this survey to prepare for your final paper, and we'll talk about your final paper here in a moment. Your FICIT for this week is Luke 15:11 through 32. This says, after reading the familiar story of the prodigal son from the perspective of family systems. Very interesting, right? Probably many of you have heard this story preached about from multiple different perspectives, this parable of the prodigal son. You may have read it even multiple versions, but have you considered it from a family systems perspective? It's very interesting. Consider how each of the members of the family relate to one another. What is the nature of their interactions, and how does the behavior of each member reciprocally affect the others? Imagine yourself as a counselor for the father and the older son. Wouldn't that be fascinating? Just before the younger son returns. Imagine how you might employ a family systems approach in addressing the experiences of both the father and the older son. Or even an interesting thought experiment. Imagine you were working with the father and both sons. together in one room after the prodigal son returns, how would you work with them and help them reconcile with one another? It's a very fascinating idea. So you've got your role play for this week. So let's take a look at this. You're going to choose one of the theories from the last 4 studied. So feminist, existential, postmodern, and I would ask, please don't do postmodern, do either narrative therapy or solution-focused brief therapy. Choose one or the other if you're going to do, don't just call it postmodern, because those two approaches are very different, and what I might see and how you might conceptualize are very different. Those two lump under the umbrella of postmodern, but the approaches are dissimilar. So please specify if you're doing postmodern, which of those you're doing, or family systems in your role play. You're working with the same role play partner. I would encourage you to please consider that I've asked for a 30-minute session and I want to see a 30-minute session, please. You still need to give me the timestamp that you want me to watch, but I want to see a full 30-minute session from you in the counselor role, which means that you need to block out probably an hour and a half working with your partner, because you'll do 30 minutes in the counselor role, 30 minutes in the client role, and then of course you've got the feedback part that you're giving each other feedback as well. Please keep in mind what I've said about feedback. It's important to give your partner feedback. It's invaluable, because when you begin working with real clients less than a year from now, it's not their job to give you feedback on how you're doing as a counselor. This is crucial to get the perspective of someone in the client role on what you're doing well, that you can strengthen your strengths, and what you might do differently, your growth areas. So please elicit that feedback, and please be honest in giving feedback to your partner. Any little bit helps, right? So, yep, please continue that. Oh, and please consider using the wrap-up that I taught you. Okay, or you can act as if this is, I believe, possibly a termination session. So either one of those two ways, endings, which you've practiced in a skill setter. You've practiced doing some termination type tasks with the client who was telling you all the ways that he's grown in counseling, and he had gotten a job, remember? So you've practiced a little bit of what termination looks like, so you're welcome to do that as well. Okay, so that's the role play. Then you've got study practice questions. You're used to those. Survey for the final paper. Please take this survey. You've been taking sort of surveys for each individual theoretical approach. Now this is one that sort of puts them all together and asks you questions to help you see which one you most closely align with. And then this is a final paper heads up. So this says, in session 13, so next week, you'll be completing a 3 to 4 page paper reflecting on and describing your developing counselor identity and theoretical orientation. Please begin gathering your completed theory inventories, reflecting on how the readings, videos, and assignments in the course have influenced your view of your emerging counselor identity. Y'all, please do not write about that you are this theory plus this theory plus this theory. If you do that, I'll know you're not watching these announcements. I know you're not listening to the feedback that I'm giving you, because even advanced counselors need to ascribe to a single counseling theory. They are so complex, so rich, that it takes years to master a single counseling theory. The thought that you could pick and choose is typically based on the conflation of my counseling theory and the interventions I use. And remember, I've told you guys multiple times, those two things need to be detached from one another. I don't impose my counseling theory on my clients any more than I impose my values or belief system on my clients. So the counseling theory that I hold should match with me, with who I already am, how I already see the world, my worldview, my paradigms. But the interventions that I use with each client should be ones that I have a strong reason to believe will work well with this particular unique person or family system, right? Couple, family, whatever group, but I should have a good reason to believe that this intervention will work well for this particular person or situation, this particular case. And that should change with each unique case. Okay, so theory for me, interventions for them, and you don't conflate the two. So my theory fits well with me, one single theory fitting well with me, helping me conceptualize, sometimes helping me choose the language I use in counseling to some extent, the types of questions that I ask clients. Those can be influenced by my theoretical orientation, but overall my intervention should be chosen based on the client, not based on me and what I think about the change process. I hope that's helpful. So when you're writing your final paper, please choose one counseling theory and talk about how that is the one that fits best with you. Please keep in mind that person-centered is a great theoretical orientation, but person-centered asserts that the therapeutic relationship characterized by those core conditions of empathy, congruence, and unconditional positive regard is necessary and sufficient for change. Sufficient, meaning that's all you need. Okay. And if you were to say, I'm kind of person-centered, but I'm also CB2. I'm kind of person-centered, but I'm also existential. Kind of person-centered, but I'm also feminist. Then you're not person-centered, because while everyone agrees that those core conditions are necessary, not everyone agrees that they're sufficient for change. And if you're adding another lens to it, whatever that other lens is, that other theoretical orientation, you're that one. All great counselors appear person-centered. All great counselors prioritize the therapeutic relationship. But anybody who adds any type of additional lens to that is not person-centered. Hope that's helpful. So as you're thinking about what theoretical orientation you most closely identify with, if it's person-centered and something else, go with the and something else. And if it's only person-centered, that's the only reason you would write about that one. Okay. Hope that's helpful. I'm looking forward to seeing your role plays this week. I will work hard to get the feedback back to you quickly, but please know that I watch every minute of every single one of your role plays. These are 30 minutes each. It takes quite a long time, and then to give you the video feedback. I hope you found it helpful. It's important to me to be formative for you as you're working on your basic counseling skill set and working to sort of wrap your head around how do I grow my competency in providing therapy for clients. So I should be available for office hours this week. You guys are welcome to pop into my Zoom. If you need me individually, please shoot me an email and I will send you a Calendly link so you can schedule a 30-minute Zoom with me. All right, y'all. Have a fantastic week. Thanks.